Hi, everyone. Welcome to Facktor's Next Hot Takes video. I'm Alex Knettel, the Client Relations Manager here, and I'm with Ryan and Lelenia, two members of our clinical operations team. Lelenia, can you start off by introducing yourself?
Lelenia Ramirez. I'm a senior director here and lead our clinical ops team. I have about, 17 years of experience in the FQ realm and the operations specifically.
Wonderful. And Ryan?
Hi, my name is Ryan Rizik. I'm a licensed clinical social worker. I've had about 3 years here at Facktor, and I'm a manager in our clinical operation division. And my background also includes some work in FQs, as well as hospitals and community health centers.
Wonderful. Let's dive right in, talk about behavioral health. So one thing we keep hearing over and over from many health centers is how they're so overwhelmed by the amount of patients that have been requesting mental health services since COVID. How should they be managing that growing need?
There's a ton of need. That's one thing that we've realized from COVID is that there are so many people now that are accessing services or wanting to access services. And it is something that a lot of organizations are struggling with. And there are some fixes and some ways, some strategies that can be used to help mitigate this. There's different things like 30-minute visit types. There's ways to optimize scheduling templates. There's various strategies, like there's one called jockeying, where if a patient cancels, that you're able to call somebody that's on the waiting list and plug them right into that appointment so you don't have a no-show. So there's things like that that organizations can do to really help to benefit this growing need.
I heard you mention briefly 30-minute visits, and as an operation officer in my experience, I'm really curious to hear your experience on that and how you manage some of the change associated with that different dynamic of seeing patients in a shorter period of time.
It's a change from traditional therapy. I think a lot of us are used to seeing things 45 minutes to an hour for patients, which is great. However, in the FQHC and health center environment, sometimes we're not given that amount of time to really care for our entire population, right? One of the words we hear a lot about these days is population health management. And that's really figuring out how can we utilize our resources to maximize the health of the entire population that we're serving versus just the individuals that are able to access care. So one of those ways that we can ensure that we're opening up access to more patients is to utilize 30-minute sessions, which are seen as very effective. And instead of viewing it as, sometimes clinicians can say, well, I feel like I need to spend this much time with a patient because I don't want to, shortchange them. But in reality, when we're operating at an hour-long session for a patient, that means that we can actually only serve half the amount of patients that we could if we had 30-minute sessions. So rather than looking at it as, hey, these patients aren't going to get enough time, it's really like, hey, if we don't do it, there's going to be this amount of patients that aren't going to get any time. And that's really where we see the dramatic difference in how we can work to improve population health.
Where's a good place for health centers to begin when, thinking about strengthening their behavioral health service lines?
I think we're at a really interesting crossroads for most health centers in terms of stepping back and learning from the past 2 years in our experience and really thinking, what do we want moving forward, and having an honest and objective assessment of where do we want to go and what's the roadmap to get there. So I think the first part is answering that question, like what is behavioral health service line for each of the health centers? Where do you really vision that going? And then really assessing, how do we get there? And that's something that the team could do internally with a roadmap. They can bring in external, support, consultants or others to really support them through that process. But I think it is time. We're at that critical time because of where COVID put us. And it's very necessary to really determine what the appropriate next steps are to expand behavioral health, because I think we all can come to the table and say we need more behavioral health, and right now is the time to do it. So how do we go ahead and do that and do it effectively?
All right. Thank you for your time, Ryan and Lavinia. See you guys.
Alex.
Bye.